We want to move on to this story now. We're learning more about the woman who police in Washington say led them on a frightening chase this week. In the end, she was shot dead.
Yeah, Miriam Carey's family says she had suffered from postpartum depression with psychosis.
Her boyfriend said that Carey had trouble sleeping. He also said that she had delusions, that she was under some sort of surveillance. He was worried about the safety of their child together. Carey's relatives say they want an investigation into her death, and they also question what the boyfriend was saying about her being delusional. Take a listen.
It's very unfortunate that Miriam is not alive right now, and a lot of things are being said that she seems to be crazy or schizophrenic or things like that. I can tell you that she was a woman, that law-abiding citizen, carefree, loving, just like anyone else. She had a baby, and she did suffer from postpartum depression with psychosis, which comes along with medication and therapy, which she did. She was very compliant with her medication. At the time that she was diagnosed with that, as you know, depression can have a certain level of instability at that time, which is why she was diagnosed.
Well, the role that mental illness may have played in Thursday's Capitol Hill shooting has a lot of people searching for answers this morning, including Carey's family.
So let's open this up, answer some questions here. What are postpartum depression and psychosis, and what are the warning signs for both the new mothers and for their families?
All right, so joining us to discuss all of this, psychologist Erik Fisher, known as Dr. E. Let's begin with this. I think it's a very important differentiation to make.
Right.
Postpartum depression is fairly common for new mothers, and postpartum depression with psychosis or postpartum psychosis is very rare. So let's talk about the difference.
Well, I think first we want to start also by talking about the baby blues. The baby blues is very common. Because you have this rush of hormone activity after a child's born, it can affect somebody's emotions, and those hormones are going to influence our neurobiology, which is going to affect our perception of the world and reality. Postpartum depression, though, occurs in about anywhere from 9 to 19%, or what different studies say. Postpartum psychosis is about 0.1%.
Wow.
But what we have to understand are the difference in the symptoms from somebody who's having a baby blues, where they might have bouts of sadness, difficult eating, mood swings, things like that, hard time sleeping, to more significant issues of depression that come with the postpartum depression. This can also come with difficulty attaching to your child, thoughts of hurting your child, and even some isolation issues that can occur in that. Postpartum psychosis, the difficulty with that is you're really losing touch with reality, and you can have delusions, you can have auditory and visual hallucinations, and the key to depression and psychosis, both of them need to be managed often psychiatrically with medication. It's not something that people can just work their way through like the baby blues.
Now, the Carey family wants to know if protocol was followed properly in this situation. Is there any way with a woman who's driving this, as it's been called, 1,400-pound weapon, to reason with a person who is in this state?
You know, when people get in a state of delusion, delusional beliefs, what they believe is their right. That's the way they see the world. One of the things about, she might have been treated and come through this very well. However, sometimes even menstrual cycles can trigger a relapse of some symptoms, so we don't know what happened here, and I think it's important that we kind of talk generally about this situation, but you have to look at other risk factors too. Traumatic brain injury can be a risk factor, previous history of psychoaffective disorders in a family, any other traumas could be triggers that could lead down this road to some of these outcomes that we see in this situation.
All right, Dr. E, we appreciate your expertise. There's still some discrepancies on any injuries, anything that might have happened leading up to this, so we're still trying to build out that full picture. We may never know exactly what she was thinking then, but we thank you for discussing it with us.
Thanks for joining us.
Thanks for having me.
Appreciate it.